Okay, yeah. Hello, everyone, and thank you for the opportunity to come here to speak. And I don't have any disclosures. So the aim of our study was to evaluate the efficacy, safety, and overall patient satisfaction of the TVTO procedure in long-term follow-up in patients suffering from primary or recurrent stress or mixed urinary incontinence. Materials and methods. This was a single-center retrospective study conducted in Turku University Hospital, Finland. Women with stress and mixed urinary incontinence treated by TVTO, as originally described by the Leval under local anesthesia between August 2004 and October 2011, were invited to the follow-up visit in 2016. 18% of the 106 patients had recurrent urinary incontinence preoperatively. 6 of them had had 2 or more anti-incontinence operations. And here you can see the list of the previous operations. Results. No bladder or urethra perforation or hematoma, no major vessel, nerve, or bowel complications occurred. A mean time from the surgery to the follow-up visit was 9.25 years, range 64 to 144 months. 90 patients were objectively cured, defined as a negative cough stress test, and 86 patients were subjectively cured. They answered to be very satisfied or satisfied to the operations. And here you can also see the results in different subgroups. At the clinical examination, we found 3 asymptomatic vaginal tape erosions. 3 patients had post-void residual urine volume over 150 milliliters, the biggest PVR being 212 milliliters, measured by vaginal ultrasound. 17 women reported groin pain. 1 tape was cut because of retention problems. It was 3 months after the surgery, and the patient remained continent. 7 women were using medication for overactive bladder, and 14 new prescriptions for overactive bladder were written. Conclusions. TVTO procedure is effective and safe in women who suffer from stress urinary incontinence, having high objective and subjective cure rate 9 years after the surgery. TVTO procedure is also a therapeutic alternative in different subgroups of urinary incontinence, including also recurrent cases. Thank you.
Any questions?
Thank you. Are you worried about the statement that it's safe when my understanding of your data is that 16% had groin pain, thigh pain?
Yeah, groin pain. But our mean age was 66 years, so we were wondering that maybe it could be some other medical condition because the patients were so old, so...
So it's a pretty heightened
it is.
Legal environment. I would be just really a bit cautious about not... the word safe is certainly a very loaded one.
And our limitation was that we didn't have a group that didn't undergo the operation, so it would be good to...
So is your gut feeling that the groin pain is due to some other condition?
Yeah, maybe then we could see that. So yeah, we should have a control group also. So without the surgery, then we could say.
But you think that it's unlikely to be the TOT that's the cause of the groin pain?
Yeah, maybe. Yeah.
You think it might be?
Might be, yeah.
Continuing on that theme, Zimran from Dallas, when was the pain? When did it start? After the surgery or years after? It's unrelated? Do you have this information?
I don't know. I can't say that. Yeah, it was just that they say that they are having groin pains.
And it would be also interesting to look at other things like, we've presented, urinary tract infection, sexual function. Those are important things.
Yeah,
we see countless of people who had a sling and show up just with UTIs 10 years ago with a sling. Nobody put the two together. They have avoiding dysfunction, high residuals, and they've been treated by the infectious disease doctors, and they're about to, die of urosepsis. That's not negligible. And some people say they never had sex again after the surgery, so they may be dry. If you look at the whole pictures what happened after this operation. I think that would be enlightening if you could
Yeah,
do that
that's
for
true.
this
Thank
group.
you.
Thank you.
The main problem of TVTO is the growing pain. You reported in your experiences 16%, and this is the main problem because TOT have real great efficacy as you demonstrated also in your experience, but there is the reported data between out-in versus in-out is this one of the, I think that is not a secondary side effect because it's important and we saw women that have sometime intractable growing pain, and this is one of the main concern, just looking carefully with this procedure.
Yes, that's true.
I have one question also about another complication. Around 20% of the patients reported de novo urgency that is also deteriorating quality of life. Could you give us your thoughts about that?
Yeah, that's also quite high, but also it was 10 years or 9 years we followed the patients, so of course it could be also caused by the age, not because of the surgery, but of course it's quite hard to say. But I think that maybe also the age could be one reason because of that.
Okay.
Thank you.
Thank you.
Thank you.